Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart Life as a Dad and a 35-Year Cancer Survivor, available on Amazon. Over my last two videos, I've talked about my list of long term side effects that I'm dealing with from my cancer treatments from back in 1988 and 1989. And then I followed it up with another video organizing the doctors that I see and how I've combined all my appointments into basically a 1 week period where I go to see the doctors every day of that week, and everything gets done to me from blood work to scans, ultrasounds, things like that. Everything's done all at once. I want to talk now about the individual doctors that I personally get to see. If they're a part of your care, your list of doctors may be different, but I'm going to go into the different things that are done. I want to talk about briefly where to find out what do you need to get looked at as far as be concerned with long-term side effects. I mentioned repeatedly the Children's Oncology Group having what is called a survivorship guideline. Again, do not be put off by the title of the organization, Children's Oncology Group. What this is, it's a group of oncologists who got together and took different treatments, whether it be radiation, chemotherapy, drugs, immunotherapy, surgeries, things like that, and came up with a list of things to be looked after, surveilled, whatever term you want to look at, basically for the rest of your life to make sure that you have not developed any late side effects, or if you do, what to do about them. So, with that, and I'm going to offer a little side here. If you are a Hodgkin's lymphoma survivor, we also have an organization called HodgkinsInternational.org. There you can also find specifically the listing pertaining to survivorship needs with doctors and testing and things like that. As far as finding information from the Children's Oncology Group, you go to survivorshipguidelines.org. So the first doctor that I want to talk about is the primary care doctor. Okay, this is going to be your main advocate. This is going to be the one that is going to be gathering all the information from all the different specialists that you see. They keep all your information central. And this is a doctor that needs to be aware, needs to understand everything that is going on, so that if there's a need for them to advocate or act on your behalf, they're aware of what you're dealing with. Now, for administration purposes, you have to watch when you make an appointment with a primary care doctor as a cancer survivor. Okay? There's a thing called coding. Okay? And that's what insurance companies want to see. And they expect an appointment with a primary care doctor to be only 10, 15 minutes at most. That doesn't work when you are a cancer survivor. It takes that long just to review your health history. So there are coding exceptions to extend that visit, whether it be a half an hour, 45 minutes, or an hour. Okay, it's an exam with a complicated history, and you have to make sure that your primary care doctor codes it that way. I'm in a weird situation right now because my primary care doctor just retired after nearly 40 years. That's right, I've had the same primary care doctor for nearly 40 years. In fact, she was only my third primary care doctor. My first one passed away when I was 14 or 15. He passed away still practicing in his 80s. I had one doctor in between him and the doctor that just retired. That primary care doctor has been definitely my best advocate in my survivorship, especially over the last 18 years, dealing with all the health issues that I've had to deal with. So I got to deal with my new primary care doctor 5 months ago. I will be going to see him again next month. So we had a great first visit. He understands survivorship issues really well. And now it's time for him to start understanding all the different specialists that I see and what to do with that information. Now, as far as what I expect of him, he obviously will review all of the appointments that I have or will have, and it's his responsibility to cover other areas that I don't see a specialist for. In particular, there's one in that I don't see a skin doctor. Okay. Now, having been exposed to radiation therapy, I'm at an increased risk of skin cancer. So I need somebody to check out my area of my upper body, front, back, head, neck, for any signs of skin cancer. Now, this is covered up, but if you can see right here, this is a spot that constantly gets attention. So far, nobody has investigated that yet. It hasn't, I guess, produced the type of shape that they were concerned about, or texture, or whatever they look for. So that has not been biopsied. I did have a scare back in 2012, a spot on the back of my neck that was biopsied, a nice big hole in my neck from it. That also did come back negative. But the thing is, you have to keep an eye on that. Skin cancer is treatable if it's caught early enough. So part of that, the task of that primary care doctor when I see him is to check me all over physically with his eyes for any signs of skin cancer. I also do have skin tags, which do not necessarily lead to skin cancer, but could become that way. So he's got to check out those as well. The other thing my primary care doctor will do is coordinate all of my medications for me. I make sure that there's no mistakes, so I make him do all of my prescription writings. I make him coordinate all the labs that have to be done. And then if there's any other tests that need to be done that weren't covered by the other specialist, I will have him do that as well. And then, of course, I mentioned him being my advocate. I need him to communicate with my other doctors as needed. If he sees something that one of my other specialists wrote down and isn't really paying attention to it, I expect him to review my visit with him and my concerns, and they work together as a team. And if there is any issues with my appointments, with my insurance, with other doctors, I expect him to handle any appeals that I need made on my behalf. Of course, as a patient, I'm not going to stand a chance arguing with an insurance company. That's on him, and I expect him to do that. I have a very good relationship with my primary care doctors. They don't see me unless I really feel there's something wrong. So I'm not a nuisance to them. So if I ask them to do something for me, it's a rare thing that I do that, but I expect them to do that. So that's my talk on primary care physicians. My future videos will pertain to specific specialists that I do see and the different things that I have done and the different things they are looking for. But just remember that the main part of cancer survivorship follow-up and surveillance begins with the primary care doctor. You're done with your oncologist. After 5 years, they have no reason to follow you up. They're going to tell you that. They're not looking for your cancer to return anymore, and follow-ups are not about the return of cancer. They're about making sure that you're not developing any late side effects. It's not guaranteed you will, but since you don't know if you will or not, you need to be in touch and in communication and in a relationship with your doctor to make sure that they catch these things if they develop sooner than later. Until next time, this is Paul's Heart.